Can you do a sit-up without anybody holding down your feet and without you lifting the feet way up off the ground? Comment down below if you can do this or if you can't. In today's video, we're going to be talking about why someone might need to use that counterbalance of the leg lift or the foot pressure down in the sit-up to complete that sit-up. Listen, contrary to popular belief, sit-ups are not bad for your spine. If you're having pain during or even afterwards, then it just simply means that your spine is not acclimated to tolerating that forward movement at this current moment in time, either because it is sensitive as your back is currently experiencing pain, or the spine is sensitive to the pressure that is accumulated during a sit-up. And that's all that you're really dealing with here, honestly, is just pressure. We aren't afraid of pressure when we're walking. We're not afraid of pressure when we're jumping. We're not afraid of pressure when we're lifting. In fact, in cases such as osteoporosis or osteopenia, we actually encourage pressure through the bones so that it develops an increased resiliency or strength and capacity to tolerate doing more. So if we take that mindset to any exercise and apply it to a sit-up, why do we all of a sudden think the pressure that the spine experiences in a sit-up is inherently bad when we consider pressure in every other area of the body perfectly normal, fine, and healthy? All the examples I mentioned earlier, such as jumping, walking, squatting, lifting, any of those, anybody could experience pain with if they're not ready to handle that activity. So really, if you experience pain with the movement, it's an intolerance to that specific movement or a dosing issue of the load, frequency, or volume. Now, this video specifically isn't about how to do sit-ups comfortably. What this video is designed to teach you is where you're actually placing stress in the body from a muscular standpoint. Now, one thing you'll notice when you watch a lot of people do sit-ups is that they require a decent amount of foot support. When you put pressure at someone's feet to allow them to do a sit-up, what this immediately does is allow the individual to use a quad dominant strategy, in particular the rectus femoris. When you take away the counterbalance at the foot, this means the person all of a sudden has to shift to more of an abdominal strategy to perform the sit-up. So someone who really struggles keeping their feet down while doing a sit-up likely biases using their rectus femoris or their quad more so when dealing with spinal flexion, or another way of thinking about this is abdominal compression. So this is where you'll find most people have weaknesses in, is the ability to compress their abdominal region, which means expand the backside of their back, which if you're experiencing any type of compression-based low back pain, then that flexion or that compression in the abdominal region may actually feel comfortable and helpful for somebody's pain. Now, this doesn't necessarily mean that one strategy is good nor bad. You can find usefulness out of doing both. If someone's dealing with a hip flexor issue, it may be worth your while to rebuild the capacity of the rectus femoris so that they can tolerate tension in that muscle again. In the same regard, someone might be dealing with abdominal weakness that we might want to strengthen and bias the abdominal region a little bit more so than relying on more of a rectus femoris quad-based strategy to flex the spine. So depending on what you feel this person may need to train or get better at doing or get better at tolerating, you may bias your sit-up in a particular fashion that emphasizes either the abdominal region or the rectus femoris. One tendency that I've noticed in particular is someone who struggles with a seated toe touch position tends to struggle with compressing their abdomen. This is part of the reason why they struggle with completing the toe touch in the seated position, because they lack strength in that shortened position of the abdominals, transverse abdominis, internal obliques, and external obliques. These are also the same individuals who usually stand with their hips forward out in front of their center of mass, which puts the rectus femoris or the quad in a lengthened, stretched position, and the back in a compressed position. And as a result, the inability to reverse that posture or reverse that position is where people tend to struggle with. So shortening the front side of the body, being able to compress the front side of the body and experience length through the back side. Now, if you're someone who's dealing with hip or back pain, struggling with sit-ups or struggling with any exercise in general and would like more of my direct help, you can email me, greg@sportsrehabexpert.com, and we can set up a time to talk and discuss what that process would look like. Or if you'd like a little bit more of a DIY or do-it-yourself program, you can sign up to our online training at sportsrehabexpert.com.